The Washington chapter of the American College of Emergency Physicians sued the state Medicaid program in late September. They won the first round in November when a county superior court judge ruled that the state's plan to limit emergency room visits could not go forward. The limits were ordered up by the legislature in response to the state's budget crisis. But the order also required Medicaid officials to collaborate with physicians on a list of non-urgent conditions that would no longer be covered. Emergency physicians were not happy with the final list, which prompted the suit. Washington State ACEP President Stephen Anderson explains.
The healthcare policy for Washington for the treatment of the Medicaid population was based entirely on economics. And the list they came up with was a list of their non-emergency diagnoses, which was not collaboratively arrived at and was universally pointed to them by the emergency medicine physicians as containing things like chest pain, abdominal pain, syncope, hemorrhage with miscarriage. That was unacceptable. Part of our lawsuit surrounds that list. It has to be collaborative, and it has to be one that truly represents non-emergencies. But there's more to this than just that. The whole access to emergency care is impeded by this. It goes into the effort of restricting the prudent layperson protection that every American has at the moment. That protects you and I and everyone for the right to emergency care when you need it without retrospectively being denied by your insurance carrier. The state of Washington's Medicaid program has said that does not apply to their patients. So we've actually floated out several things. We think that if there is any list, the list has to be arrived at by the specialists in emergency medicine if they're emergency diagnoses. The second part of this is that we do not want the prudent layperson law in any way infringed upon. But third, we want to float out a 12-point plan that we actually think in the long run will save the state more than the 2-year $72 million price tag that they're trying to achieve.
Washington's Medicaid program was ordered by the judge to hold hearings and collect comment on its policy before it can move ahead. But there's another battlefront. State legislators are meeting in special session during November.
As much as I hate the $72 million cuts, they're going back into special session to cut more out of our budget. So we have to come up with a solution that's not just don't pay the bill, keep people away. We have to come up with solutions that are going to work for even larger cuts in the future.
I'm Alicia Alt.